Some of these are way more important than others. We'll call those primary. In other words, if something's way more important, or the most important, we're going to call it primary versus secondary. Also, we have what's called relevance. Well, there's all kinds of documentation you can do, and most of it's not relevant. So I'm not going to go over documentation that's not relevant. That's not what I'm... Now remember, I'm talking about the low impact soft tissue spinal injury. The relevant documentation for that particular category. Because there would be way more relevant information for a high impact injury. And that would be different. It'd be this plus additional. So relevance. And then the other factor we're going to pay attention to is what's called high and low sensitivity documentation. Well, there's some documentation that's called low sensitivity. It's essentially worthless. What do I mean when I say low sensitivity? Essentially, it's normal at MMI. It's normal. It could be positive initially, and sometimes it is. But that's not what's important. And now I'm talking about, when I say important, I'm talking about from the legal aspect and from the attorney aspect, not from the patient's clinical perspective. So let's understand this up front. I'm going to be talking about from the legal perspective and the injury award. And that is totally separate and different than the clinical perspective. And okay, so that's the perspective we're talking about. And we're talking about low and high sensitivity. So in other words, we're going to be paying a lot more attention to tests that have a high probability of being positive at MMI, maximum medical improvement. Because that's where the value is. If you don't have an impairment with pain and restrictions of ADLs at MMI, you essentially don't have much of a case. Okay? But most of these cases, these soft tissue injury cases, they have all of these. They're not being documented properly. And I'll just tell you why. Number one is the doctors are doing low sensitivity tests. They're not even doing the tests that find the problem. That's the number one reason why. And the most common way to know without knowing anything, if it's that kind of doctor, is that's the doctor that his primary diagnosis is cervical sprain strain. That's the doctor that doesn't know what he's doing.